Hi, Dr. Jereme Trunk at Balance Within Integrative Physical Therapy, here to give you a 1-minute rundown as to how CranioSacral Therapy can help with chronic headaches or jaw problems. This right here, this is a model of the human skull. This is not one solid piece of bone, but rather multiple bones that need to work and move together to help make sure that everything is working well within the head, neck, and jaw region. These lines right here, these are called sutures. These areas can get restricted, oftentimes affecting the ability for these bones to move within a system. So at times we will find that when you are releasing these points here and actually opening up movement with this can decompress things that are going on the inside. For the jaw, this bone right here, this is your temporal bone. If you've heard the term temporal mandibular joint or TMJ, that is this bone and this part of your jaw coming together at this joint right here. A number of times for patients who have dealt with jaw problems, we have found that this bone right here can be locked down due to some of these other bones not having the proper movement in there. So you may have tried a few different things such as splinting or some other therapies that may not work. One of the things that could be addressed is making sure your cranial bones are moving to make sure that your jaw and your head are in good balance. If you have any questions, if CranioSacral Therapy could be a fit for helping you with your headache or jaw pain, or have any questions about it, reach out to us. We're happy to help you on your healing journey. And until then, be well.